Morning everyone, this is a case of GMG, 28 years old. Female born on September 8, 1990, a Catholic, lives in 16 Girayan, St. Doña Imelda QC. She is a housewife, married, and her nationality is a Filipino. Patient's dental chart presented a class 1 occlusion, tooth number 18171411 2124 252627 2834 and 35 needs to be restored. Tooth number 1121 36 and 37 has a composite restoration. There are 32 number of teeth. Chief of complaint of the patient in the dental field, in his own words, sumasakit bagang ko sa dulo, referring to tooth number 38. In English, I feel pain in the left lower quadrant. In medical, namumula ang mata ko, eye redness. History of present illness. In dental, 5 years prior to consultation, patient noticed that her tooth 38 is erupting and pain was felt. No treatment was done. 7 months PTC. Patient noticed that the eruption of her 38 is vertical. As the result, she tends to accidentally bite her cheek. Still no pain was felt and no medication was done. 1 month prior to consultation, patient went to an orthodontist to correct her anterior crowding. Then the dentist suggested to remove her lower wisdom tooth to prevent relapse of the treatment. In medical consultation, 1 year prior to consultation, patient noted eye redness on her left eye, which started in the morning while at work. 7 months prior to consultation, patient does not complain of eye pain nor change in visual acuity. There was noted increased tearing of the eyes, discharge noted to be watery, non-mucopurulent with no noted itchiness. There was no history of trauma, but the patient had manipulation by rubbing her eye. On the day of the consult, symptom of redness of the eye persisted. Past medical histories of the patient revealed in the dental field. Patient had their posterior teeth extracted on tooth number 16, class 3 restoration on tooth number 11 and 21, class 1 restoration on tooth number 36 and 37. Past medical history, there are no complaints for medical. Family history revealed in the mother's side, known history of hypertension, diabetes mellitus, cerebrovascular accident, while on the father's side, known history of hypertension and diabetes mellitus. Personal social history shows that the patient has a balanced diet, regular exercise, non-smoker, and non-alcoholic drinker. She denies use of illicit drugs, worked as a telecollector at a local company for 6 months. Review of systems. No complaints for general skin, head, eyes, positive in redness and ears. No complaint for nose and sinuses, throat, neck, and also for the breast as well. There are no complaints also for respiratory, cardiovascular, muscle, bones, joints, and legs, and also for the gastrointestinal. And lastly, no complaints for peripheral vascular, psychiatric, hematologic, and also for the endocrine. For the general appraisal, patient can talk clearly because of class 1 occlusion. Patient is awake, alert, oriented. Patient is well responsive and talks in an orderly manner. Patient behaves properly. Patient is well dressed for the weather and properly groomed. There are no signs of distress noted.
For the vital signs, blood pressure 120/70 mmHg, temperature 36.8 Celsius, pulse rate 82 beats per minute, respiratory rate 19 beats per minute. And for the physical examination, no complaints for the skin, head, ears, nose, and sinuses, throat, and positive for redness of the eyes. For extra oral examination, Symmetry of the face, symmetrical. Temporomandibular joint, clicking sound absent. Pain, swelling absent. Lip examination, negative to crack, fissures, negative to ulcers. Lymph nodes not palpable. Facial profile straight. For intraoral examination, oral hygiene poor. Gingival color pink. Consistency of the gingiva resilient. Pathological conditions positive to torus palatinus. Tongue negative, elevations, coated fissures. Position of the tongue normal. Occlusion class 1. For physical examination, no complaints for the neck, thorax, cardiovascular, breast, abdomen, genitalia, rectal, and extremities musculoskeletal. For assessment, for the dental, third molar impaction, class 1, position 1 vertical. For the medical, PC, dysfunctional tear syndrome, OU, pseudophakia. Residence assessment, pseudophaky, OU. Treatment plan for non-pharmacological. For the dental, fabrication of fixed bridge on tooth number 15 and 17. Removal of third molar impaction, tooth number 38, odontectomy. For the medical, healthy living, drink a lot of water, 8 hours of sleep, avoid long-term use of gadgets. Treatment plan for the pharmacological. For the dental, mefenamic acid 500 mg 3 times a day after meal. Amoxicillin 500 mg every 8 hours for 7 days. For the medical, Optip eye drops 1 drop each eye 3 times a day.
And for our journal, our topic is all about the impact of pseudophakia on visual-related quality of life in the general population, the Gutenberg Health Study. So, our background of the study is, for the first time, the report of the prevalence of pseudophakia and aphakia in Germany is a population-based study and investigated the causes of aphakia after the introduction of phacoemulsification and implantation of the posterior chamber of ocular lens. So, next is our significance of the study. The cataract surgery is the most frequently performed surgical procedure worldwide. We aim to determine the prevalence of having implanted an artificial lens and no lens, and to compare visual functions. And for the methodology, our sample is 15,010 participants was randomly drawn from local governmental registry offices. The cohort was equally stratified by sex, urban and rural residents, which within each decade of age. So for each participant, a comprehensive ophthalmological examination was conducted, and these variables of aphakia and pseudophakia were validated using refraction and ophthalmic medical history. And the conclusion, in summary, the prevalence of pseudophakia ranges from 2.2% in the 35 to 44 year age group to 13.4% in the 65 to 74 year age group in Germany. Vision-related quality of life measurements indicate that bilateral pseudophakia can almost imitate the physiological condition of phakia, except for the need to use glasses. And aphakia is currently a rare condition in Germany and is primarily caused by trauma or consequence of congenital cataract. And so for our dental relevance is, in dentistry, it is important to have a good eyesight because we are treating patient's oral cavity and deals with a very small measurement. That's why we need to take care of our eyes, good eyesight, and provide good quality services on our patient. Thank you.